My dentist tried to do the regular implants that I could then connect my denture to, but those didn't take into my jawbone. There just wasn't enough material on my jaw, I think, to do that type of an implant. And so after a couple of failed attempts there, he recommended that I come and see the specialists that would do a different type of implant. And so I have two that have gone up into my cheekbone, and then the others are just in my jawline.
Mr. Crosby was done today, and that's what we did with him. Placed 2 implants, as he'd had other implants placed by his general dentist. Unfortunately, they had used all the bone. The implants had failed and left us with not a lot to work with. So, long story short, just using a different technique. And it's something important that obviously you're using a technique, using zygomatic implants. You have to be very well aware of the anatomy, what you're doing, experience, and we're one of the few in the country who do this routinely. And we do it for your safety, but also to get you some teeth the same day of surgery and not have a drawn out process of months and months and months.
I was very nervous, especially since the other implants did not take. I was a little apprehensive. And I had had an infection that caused some major swelling before this happened from the from the implant that did not take. So I was very paranoid about having big time swelling and the pain associated with that, and it worked out to where I was barely swollen at all. I had heard good things, and they said that the process was a different process, that I felt I just wanted to try to do everything I could to avoid having to wear a denture for the rest of my life. Hopefully I'm going to live another 40 years or so, and not having to deal with the denture is going to be amazing.